just to begin with, there's drugs that are dangerous to come off of and drugs that aren't. So narcotics, methadone, heroin, Oxycontin, oxycodone, Percocet, Vicodin, all of the narcotics feel horrible to come off of, but they're not dangerous at all. You feel like you're dying, but there's really nothing that can kill you in opiate withdrawal. Compare that to alcohol or benzodiazepines, which are common anxiety medications like Xanax, Klonopin, Valium, Librium, or an older group called the barbiturates like phenobarbital. Those three may not even feel quite as bad as the narcotics coming off of, but you can die when you're withdrawing from them. Our philosophy, and you're going to get dueling philosophies. Our philosophy is that 99.9% of people eventually can be completely, truly abstinent off of all chemicals. And that requires a hell of a lot more than just taking a pill. It requires learning about yourself, doing what we call the recovery work, learning why I use, how I can cope with life without drugs, because remember, after somebody's used drugs for 10 years to cope with life, they've sort of forgotten how to cope with life. So a huge thing they do over the first year is do a hell of a lot of therapy to learn how do I cope with life's everyday stuff that for most people is simple. But for them, every time they had an emotion, good, bad, or otherwise, I'm happy, I use, I'm sad, I'm used, I'm angry, I'm used, I'm anxious, I use. That's how they dealt with every single emotion. We got to teach them again. Think about some of my patients, not some, a lot of my patients started using drugs when they were 13 years old. Mm-hmm. How many coping skills do you have at 13 years old? Once you start using drugs for everything, you don't learn new coping skills because you don't need to. You've got a coping skill. It's right there in your pocket. And so some of these people were starting from scratch. And that's why we've always said it's a good year, because to teach that kind of stuff doesn't happen overnight. Right after the detox, the majority of our patients do a really intense thing called an intensive outpatient program. Intensive outpatient program, and there's 4 of them in town. St. Mary's has one, but there's 3 others. Is a month-long program, daily. Here it's 3 hours a day, 5 days a week, where they come in every day, talk about what the day was like, ran into an old friend and that got me thinking, and what did you do and how did you handle it? Or I had a fight with my wife and God, I wanted to use, and how did you handle that and how could you have done that better? And even if they do slip up, it's coming back and, thank God you're back. Now what could you have done differently and better? And those are monitored. I mean, we do drug screens, and it's got social workers and counselors and doctors all in the program. So get them through that first month, which is probably the most dangerous period, get them some of the core, and then you get them into therapy and, of course, 12-step programming, NA and AA the whole time. So that's one of the arguments for using Suboxone or methadone a little longer term, is to give them a chance to learn that stuff before you throw them to the world and say, do it without anything.